Today on House Call Live, we have David Shoemaker. Shoemaker, right?
Shoemaker.
David, one good David deserves another, as I like to say, doctor. So you are an interventional radiologist. That's an interesting title. I've never heard that. I get the radiologist part, and I get intervention. I just have never put the two together.
It's a relatively new specialty, new meaning the last 8 years.
Really?
It's a combination of minimally invasive surgery and using image guidance for pinhole surgery using CT, fluoroscopy, or ultrasound.
So it's kind of, I'm going to simplify this, and I may not even be close, but I think I am. It's like when we use those robotics for back surgeries, and we sort of use we map the knee or the hip, and so we know exactly the right place to cut and all that kind of stuff. You use imagery to do what you do with varicose veins and what have you, yes?
Exactly, we do that.
Write that one down, Brian.
Wow.
Another exactly.
Dave got it right.
Glad to have you here, doctor, because let's face it, varicose veins, we're going to find out how serious they are here in just a second, but how many people have them and hate them? Spider veins.
Even more so, what are they?
Let's start with that.
Yeah. What is a varicose vein?
Varicose is a
and if you don't get it exactly right,
word.
If you don't get it exactly right, at least you can be very close.
Barely close.
All right, so they are, what are they?
Varicose just is another synonym to confuse the public. It means that it's too big. These are veins that are always there normally, and they have gotten too large because of an inherited or a traumatic. You had an injury, but most people inherit a weakness in the wall of the veins. The veins are your waste disposal system that removes all the unwanted chemicals, sends it back to the heart so that it can get cleaned up, and then reoxygenated and sent back down as arterial blood to nourish your legs. They're not dangerous, but they're a big pain in the neck. They're I guess unsightly. So many people are put off by how they look.
I just showed Lance my one clump of varicose veins, and I thought he was going to I got my arms.
He's retching in the corner.
I'm just like, oh my God, that just looks like it hurts. My wife suffers from these too, and it just, man, oh man.
I hope you don't make that face when she shows you her varicose veins.
No,
okay,
I don't.
Be a little more supportive. All right, so this happens, like you said, either genetically or through some sort of trauma.
Now, do you inherit it from a mother or a father, or does it even matter?
It usually inherits from the mother, usually. That's why women who are giving childbirth, the hormones of childbirth causes the vein walls to get really flexible and smooth because everything is trying to make everything flexible to deliver the baby down the chute. So the veins, the young mothers say, well, I didn't have these before. I've got them now.
Yeah. No, you don't want stiff veins keeping the baby from popping out, right?
I mean,
that's your body telling, everybody, all hands on deck, get ready to deliver, loosen up. That's right.
I mean, that is my wife. My wife's mother had them terribly. She didn't have them until after childbirth. It goes, perfect. Yep.
The signs and symptoms are itching, burning, heaviness. You take a trip in the car or the airplane, and you got swelling because the water in the blood is not getting up against gravity. So the chemicals are actually the ones that cause the itching, the burning, the calf cramp or foot cramps. Those are all because of a buildup of a chemical called lactic acid.
Yeah.
Who cares?
Yeah. Mm-hmm.
Now, how does the water get up, or the blood? The venous system, which is your waste disposal system, has about 50 to 60 one-way backflow valves. So every time your calf muscle contracts, it's like squeezing toothpaste uphill to the next valve until it finally gets to your heart so that it can be sent to the liver and the kidneys and your lungs to clean everything up.
Right.
So how can you help?
So what we're able to do, medicine has really come a long way. I used to take a knife and you call vein stripping. Grandma, mom, horrible procedure. Uncomfortable, long recovery. What we do now...
Not always successful, right?
And not always successful.
Right.
There is no perfect treatment for varicose veins. What we do is we use ultrasound, which is what you look at when you're delivering a baby or looking at your baby that's being growing inside the mom. And we put a very small acupuncture needle in the vein, and we put a piece of, think of it as tubing the size of a very small piece of spaghetti, and we glue them closed. And we're forcing a detour of the venous blood into veins that are, quote-unquote, healthy.
Wow.
So
you're rerouting.
We're making a detour to reroute. Exactly.
And you use this line here, or as we were reading a description of what it is you do, and a people plumber. You think of it in those terms, the piping and which way is the water or the liquid flowing. I can just see you with a tiny little wrench in there, just, wearing your coveralls. No, just kidding.
That's true.
But, I mean, that's kind of the imagery of what it is that you're doing.
I call myself a people plumber to my patients, because that's what we're doing. You think of it, what goes down has to equal what comes up. And if there is an imbalance of the arterial blood going down, being pumped by a high-pressure pump, we call your heart,
right,
and gravity pulling down, it's got to get back up, equal amount. And if it's not, you're going to have all these symptoms.
So, I want to ask a people plumber question real quick. Okay. Unlike the regular plumber, your scrubs are always pulled up properly, though, right? Is that, we have your assurance on that?
Absolutely.
Amen.
We are talking to Dr. David Shoemaker. He is an interventional radiologist on our Astria house call. And Lance, your next question is yours, good sir.
When is it necessary to, first of all, are there things before you do that surgery to do? And the second question is, at what point do I need to consider surgery?
He's talking. That's his wife talking through him there. His lips are moving, but it's her words coming out, doctor.
She did not write me or anything like that. But I mean, I see like these socks or something. I don't know.
Compression socks.
Yeah, do those things work?
They do work, but they're uncomfortable to wear if you've ever worn them. I mean, almost all of us surgeons that are on our feet all day wear compression socks to try to help minimize the amount of edema, itching, swelling, etc. And I have to emphasize, they're not dangerous. They're just a big pain in the the leg.
Sure, exactly. So when does that become necessary to do that procedure?
When you have constant pain, constant swelling, or the itching, or if you actually have bleeding that occurs as these clumps of these dilated blood vessels start to bother you, that's when you probably need to at least have an evaluation with ultrasound, where they put that KY jelly on your leg and they look on the inside to see how big is it, how dilated they are, how varicose are they.
Right. Somebody who has had pulmonary emboli, for example, should we or someone, maybe especially the deep vein thrombosis or blood clotting, should they be concerned that I think that's a varicose vein, but maybe that's an issue? What kind of signs should they look for?
Blood clots in the veins are serious. They need to look if the pain persists day and night.
Okay.
Or you can see a visible, painful purple lump. Mm-hmm. That's a sign that you should probably talk to a healthcare provider to take a look and see if your plumbing needs to be fixed.
Yeah.
One of the things the patients may benefit from is elevating their legs. So gravity helps pull everything downhill, and your swelling will go away. But you obviously can't walk around that way.
Okay.
We mentioned about this cryoablation at the start here. What is that technique, by the way?
Cryoablation is a fancy word for a needle that goes into a blood vessel, an organ, a tumor, and the needle either gets hot or cold. It's like cattle branding with a cold brand or a hot brand.
Okay.
The needle is guided. You're watching it under ultrasound or CT, some sort of imaging guidance. And as it gets hot and cold, it breaks up the DNA or causes a clot to dissipate.
Yeah. Okay. Mm-hmm. So it's an extreme temperature thing.
It's extreme temperature thing that does it. Yeah.
All right. This is different from just the colored veins that some people see. I mean, my mom had, the like blue-looking veins, but they weren't varicose. They weren't swollen. They weren't large. So what are they?
Those are
in the making?
It's in the making.
Okay.
Those are veins that originally you never could see because they're too tiny.
Right.
over time, they get bigger, and all of a sudden I see little blue, we call them spider veins, because they look like spiders. That's a cosmetic thing, not dangerous.
But they're on their way.
To getting bigger and bigger and bigger. And at some point, you're going to say, wow, this is uncomfortable, and I'm going to see somebody to...
And we're going to say, how do we get a hold of David on the phone? Because we want him to address these things, right?
Now, some people, because they drink, have those in their nose. Does that mean they're going to have varicose veins in their noses?
That's what happens.
Oh, my God. I'm just joking. I was just... Oh, jeez.
Well, sign you up.
Wow. Okay, there you go.
This could be what you do in retirement. Is just skedaddle on back to medical school, hang your shingle.
Dr. Tormey, I presume.
There you go.
All right, so to see you, this does seem like a real specialty thing. We're going to need referrals from our docs, right, to be able to get in to see you, or can we just drag our veins in?
No, they can drag their veins in. You don't need a referral from your doctor. You can just give us a call, and we're happy to see you anytime.
Where are you down in Sunnyside?
We're down in Sunnyside, yeah.
Astria. Okay,
Astria.
Look, we love these house calls. They're always fascinating. We always learn so much by having the doctors in-house versus some brief phone call or whatever. We've learned a ton this morning, and I think the most important takeaway is that they're not dangerous, but there are things you can do to address them and maybe get the discomfort out of your life. And it starts when you pop on in and see Dr. David Shoemaker at Astria and go to work. So, Doctor, appreciate your time this morning.
It's always a pleasure with all of your listeners to educate everybody what's going on in the world, and it's not something dangerous.
Right. That is good.
Great to hear. Thank you so much, Doctor. Appreciate it. Maybe we'll have you back again when Lance is in his internship somewhere as a young interventional radiologist himself.
Yeah.
And,
by the way, he can't stand the sight of blood.
There is that. Yeah, there is
that. That's maybe not that good of a move. Anyway, thank you, sir. Appreciate it.
Thank you for having me.
All right. That is your Astria.Health house call for this morning.